Hi everyone, we're just waiting for people to join and we'll be kicking off there now in a couple of minutes. Good evening, everybody, and welcome to tonight's webinar. Thank you all for joining. On tonight's webinar, we will be talking about the Munster Bovine Herd Health Programme, with particular emphasis on the bulk tank test results. And we look a little bit at the disease trends over time. My name is Elaine Dennehy. I'm one of the vets here with Munster Bovine. I'm involved in the herd health programme since 2022, and I'm joined by my colleague Dennis Howard, who's also a vet with Munster Bovine, and he's with Munster Bovine since 2018. And our colleague Maeve is working in the background to make sure that this runs smoothly. Um, so look, if there are any questions during the webinar, please feel free to put them into the chat and we'll answer them as we go along. So look, we'll get started. I'll just do a quick overview of the herd health programme. Now, we covered this on our last webinar, and that webinar is actually available on YouTube if anybody is interested in looking back at that. So look, I won't dwell too much on it, but we'll give a quick overview anyway of the herd health programme. So I suppose the herd health programme, the bulk tank testing has been offered since 2009 and it's available to all dairy farmers in the Munster area. And I suppose the beauty of the herd health programme is the ease with which the samples are collected. They are collected by the truck driver at the time of the milk collection, so herd owners really don't have to do anything. So there's different schemes within the herd health programme. So there's the bronze, the silver, or the gold. So all of the programs involve bulk tank testing 4 times a year. With the bronze program, you get the testing and your results are emailed to yourself and your chosen vet. The silver program, again, the bulk tank testing 4 times a year, and you get a phone consultation at the end of the year. And then if you're in the gold package, you get the bulk tank testing. You have phone support from the Munster Bovine vets. So if you have questions throughout the year, you can ring up the office and someone will discuss your issue with you, and you get a 45-minute face-to-face consultation with a Munster Bovine affiliated vet at the end of the year. I suppose the other thing then is with your herd health results, they are available on FarmOps, and FarmOps customers actually have access to the herd health results before they go out on email. And also all your historical results are also available on FarmOps. And if there's any doubt as to which which herd health program that you're signed up to, you can also check that in the FarmOps app. So then I suppose the next slide is just showing what diseases we're testing for and the disease schedule testing. So I suppose we try to schedule the tests at certain times of year where those tests would be most relevant. So that's just a brief overview of the times of year that the testing is done and what tests we carry out, so which diseases are tested for. The next slide then just shows the next slide. So this is just an example of the results that you will receive if you are a part of the herd health program. So all the diseases will be there. You have 3 test results, the 3 most recent test results, and they're color coded just for ease of interpretation. And then also the interpretation sheet, which is shown on the next slide. So this just is an explainer as to the results that you're receiving, what they actually mean. So that's just a brief overview of the program. So I'm going to hand you over to Dennis Howard now, and he's going to speak a little bit about liver fluke and stomach worms.
Good day and welcome everyone. So I suppose we're starting off with liver fluke, which is obviously a parasite, and it's a great one to start with because tis really a super test. The bulk milk test for liver fluke is really sensitive and a really good test. So if there is liver fluke in the herd, so the animals will produce antibodies. And I suppose the thing about liver fluke is cattle actually have very poor immunity. So while they'll generate an immune response and they'll produce antibodies, they're not able to do a whole lot about it. So the infection will persist and they will test positive for liver fluke. So I suppose, so a very good test. And the other thing about it is we test for it 4 times a year. And the big reason for that is actually the test that's going to be coming up in November now is probably the most important test for liver fluke. Because a lot of the infections actually show up late. They don't show up during the year, they show up late in the year, which was probably one of the reasons why we introduced the November test in the first place. So as you can see from the little table on the right, we're looking back we're looking at the November tests, which is probably the most relevant test. We're looking back from 2016 all the way to 2024. And the obvious trend there is a decrease in the prevalence of liver fluke in the herds in that period of time. So there's about 3,000 herds involved in the program, and that's been fairly constant now for the last 8 or 10 years. So you can see the obvious trend. And previously we would have looked at just a section of those herds, so 1,000 herds that would have been continuously in the program and no change for 5 years. And again, the very obvious trend is the reduction or the drop in liver fluke infection in those herds over those years. And I suppose why? What is the reason? And I would suggest that the first reason is actually the test is identifying the infection. So it is extremely good at identifying the infection. So knowledge is power, and the first thing is to know that there's an infection there. I suppose the second thing then is appropriate dosing. So using the right product, and we're fairly limited now with the products that we have, but using the right product at the right time and getting a really good kill. And another part of that is knowing the weight of the animals and giving enough of the product. So getting a good kill. And the third part then is actually monitoring the cure rate over the winter. So, and I suppose that's the beauty about this program, that you might have a high level of infection at the back end of the year, do a really good job dosing, and hopefully then when the first test comes in April, the following spring, the antibody should have dropped right down if you got a good kill over the winter. And I suppose if you can achieve that year on year, the effects become cumulative over the years. So if you can get a good kill over the winter, and the herd goes off grazing the following spring, free of liver fluke, they're not going to be contaminating the pasture. So if you can repeat that year on year, your pasture is going to be less infective, and you can actually get rid of liver fluke on the farm over a number of years. And we've seen that quite clearly over the years, that farmers that had high levels, that you can actually get rid of the liver fluke on the farm to the point where you can actually stop dosing for liver fluke. So it's a great place to be if you can reduce it. It doesn't happen for everyone, obviously. It is quite area dependent, but certainly if you can do it, it's a great place to be. And if animals are not suffering from liver fluke, it's going to have a positive effect on health, immunity, and production. The liver is such an important organ. So drive on there. So Maeve, we'll have a look at stomach worms. So I suppose the stomach worm that's tested for is a parasite called Ostertagii, a bit of a tongue twister. So again, we're measuring antibodies as the year goes on, and animals are out grazing. They're going to pick up this parasite, and they're actually going to start producing antibodies. And I suppose if we look at the table on the right, while there was a clear pattern with the liver fluke, there is no clear pattern here really, and it's quite year dependent, and weather has a big impact. And I should have mentioned that as well with liver fluke, that weather has a big impact. And we saw a real big impact on liver fluke with the severe drought in 2018. So it really, the desiccation of that year, there was a big drop off in liver fluke following that year as well. So I suppose the question then, that adult animals, so as in, adult dairy cows, they should have good immunity to stomach worms. And that's part of I think the job of rearing young stock, is you want to keep them parasite free, but you also want to build up immunity. And Ostertagii is one of the parasites that you want to build immunity. So when they join the herd and start milking, that they have a good level of immunity and they're not going to succumb quickly to a stomach worm burden. So the question is then that inevitably the readings, they increase over the year, and you can see the table there is looking at 3 years, kind of the 3 tests or the 4 tests during the year. And inevitably, the antibodies rise up as the year goes on. So as animals are out grazing, as the rotations build up, they're going to pick up parasites, and their antibodies, their immune system is going to respond. The antibodies are going to rise up. And I suppose the question then is, are the higher readings, are they a higher burden, or is it good immunity? And I suppose the answer to that question for me is that we have to do more monitoring really to make a decision whether we actually go dosing or not. And what do I mean by monitoring? I mean looking at performance, so looking at the milk production, the protein, the volume, looking at clinical signs. Is there loose tongues? What's the body condition like? The weather, obviously, higher chance of a burden in a wet year. And then the diagnostics, so the bulk milk screening and the other diagnostics like the dung sampling. And I suppose the other parasite, obviously, we're looking at during the grazing season is lungworm. And it's probably the bigger one, to be honest, is lungworm, that we end up talking more about. And obviously, if the herd succumbs to lungworm and there's severe coughing, they're going to be dosed. They need to be dosed at that stage. And it's the same dose. So if there's epinomectin during the grazing season, it's going to hit the stomach worms as well. But certainly, if there's no coughing, I would not be dosing just based on the results alone. I'd be taking a more holistic approach and looking at the herd, looking at the production, looking at the clinical signs. And I suppose with anthelmintic resistance and the wormers becoming more precious, we need to be really quite cautious about blanket treating the herd. So I would encourage to get advice because every time you go blanket treating, it's a big decision and you don't want to take it lightly. So over to you, Elaine. I think you're going to cover the next one.
Yeah, we just had a question now come in there, Dennis.
Good.
So the best fluke and worm dose instead of Fastnex and Eprenex and lice for winter.
Liver flu instead of
Best,
Fascinex. So
yeah,
Fascinex control contains triclobendazole. So our options are actually limited enough. So you have triclobendazole, and the brands there are Fascinex, Tribex, Endofluke. And triclobendazole kills the 3 stages of fluke. So anything after 2 or 3 weeks, it should kill. So it is the one you want to use. If you have a bird and you want to use it early in the dry period. So obviously you can't use it during lactation. Then you have albendazole, which hits mature liver fluke and stomach worms. So if there's a fluke, if you're going treating fluke, it's probably later in the dry period. So you're waiting for the fluke to mature, which takes 12 weeks, by the way, for an adult, for a fluke to reach the adult stage. And then the other one is your oxyclosonides, like your Zanil or Ruminil. So the options are limited enough, and it's hard to say which one is the best because they all do a job, and it really depends on the history in the farm. But certainly, if you're looking for to treat early, if you have a high level and you want to treat early, your best choice is triclobendazole. The only problem is we have seen cases of resistance or non-responsive treatments to triclobendazole in some parts of the country or some parts of the province. So that's probably another story. But certainly early in the dry period, if you have a high level, triclobendazole would be the first choice at that stage. And you could come back then maybe later on with one of the others.
We actually have some more questions as well, and you've actually covered one. There was one, are liver fluke becoming resistant to triclobendazole products on some farms? I think you've kind of covered that, Dennis. And then
Might
how
just add, I suppose, that the resistance, I would watch out because you can buy in or you can import resistance, and certainly with contract rearing heifers when they're going off to other parts of the country. And resistance to triclobendazole is much more common in the sheep world. But it's the same liver fluke that affect cattle and sheep, but the resistance is much quicker to build up in the sheep population. So certainly if cattle are being reared in ground where there was sheep, there's much higher chance of them picking up liver fluke that are actually resistant to triclobendazole. So it is just something to watch, if cattle are grazing on ground that had sheep, or if they're being contract reared, maybe where there was sheep. So it is something to be cognizant of.
And I suppose the beauty of the test, Dennis, is that if the levels are high in the last test of the year and you treat with your triclobendazole product over the dry period, and if you're not getting that reduction in the first test of the year in the springtime, it's a good indication that, your dosing hasn't.
It is, if you get a good kill early in the dry period with triclobendazole, it takes the antibodies then, so if you kill the liver fluke, it takes the antibodies maybe about 3 months to drop right back down to quite a low level. So the first test we do then is in April. So if you got a good kill, you should be right back down to a low level. So it's a great way of monitoring a cure. And if there's a poor cure, it means the antibodies will be still high the following spring, which is a bit of a red, I suppose, a red alarm then that maybe there's something amiss and we're not getting the result that we'd like.
Yeah. Just another couple of questions on the doses. How long should it take for Eprenex to treat lungworm? If cows are still coughing after 10 days, do they need more treatment?
So I suppose the thing about Eprenex is it only kills the adult and the later larvae. So I think the L4, the L5, that's what it kills. So it won't kill the immature larvae. And even that it persists, I suppose there's a bit of debate there about how long it persists, but you can often have infection coming again. So you could have a successful treatment that will kill the L4 and the L5, but there's more coming again. And you'll often find that the coughing will ease off a bit, but come back again. And yeah, there's no way out of it, only to treat again. But I suppose the one thing you can do is monitor the cough. So don't be too trigger happy. So if the coughing starts and it's mild, monitor the cough. Martin Cavan often talks about actually go out to the cows, listening and counting the coughs per minute is a way of monitoring the cough, and maybe doing it on a regular basis. And obviously, if it's getting worse, you need to move. But if it's quite mild and there's no major effect on production, and obviously the cows are staying healthy, there's no sick cows, the longer you can kind of hold your nerve and wait, the better chance you'll have of getting a good kill with the lungworm. But sometimes you just have to go in. But if you go in early, you'll often end up having to repeat the dose again then.
Now there are another couple of questions, but we might leave some of them to the end. Dennis, we'll move on, I think.
Sure.
So we'll talk about the Neospora now. So I suppose Neospora, it's a protozoal parasite that can cause abortions. This is a nice graph here of just the transmission. So I suppose the dog and the fox are carry it and they can pass it out in their feces, which can infect the cows. It doesn't pass from cow to cow, but it does pass from cow to calf in the womb. So if you have a positive mother, you will have a positive calf. And look, I suppose it makes them more prone to, like I said, abortions. The thing about the Neospora is the little parasite is more active in the later stages of pregnancy. So again, I suppose what we see is that the levels in the last test of the year, that November test, the antibody levels, so it's the antibodies that we're measuring with the test, the antibody levels will rise in that test because the parasite is more active. So that triggers the immune system to produce the antibodies, and the antibody levels rise in that last test of the year. So the graph there on the right hand side shows that quite nicely. So that's going from 2016 up until 2020, and each of these spikes corresponds to the last test of the year in each of those years. So that's a nice graphic that shows the antibody levels. I suppose it's important to remember the antibody levels, that they rise in the later stages of pregnancy if you are looking for it. So I suppose the bulk tank test is an indication that it's there. If you want to go and test individual cows, now look, we rarely recommend that you would blood test the whole herd, but some people, if they're looking for Neosporin, if they're looking to reduce their levels of Neosporin in the herd, what they do is they would actually blood test the in-calf heifers every year in the later stages of pregnancy. So it's just good to remember that the test will be more accurate in the later stages of pregnancy. And I suppose if you are getting a positive result, it doesn't mean necessarily that you have to remove that animal from the herd, but it would be important not to breed a replacement from her, because every calf that she will have will also be positive for Neospora. This graph here then is showing again, just the first test and the last test of the year for Neospora. So you will also see in this table the spike in the antibody levels in the last test of the year. So that's consistent for each year that we're showing here. But also, I suppose what's interesting is that the level of positive herds has actually reduced from 2020 to, I suppose, 2024. We don't have the final test for 2025 yet, but the level of positive herds has reduced. Look, I suppose we don't know exactly the reasons for that, but it may be down to herd expansion has probably come to an end at this stage. You know, when herds are expanding, they are maybe keeping cows that they wouldn't normally, maybe recycling cows from year to year. And I suppose if a cow shows up at the end of the year empty, she is more likely to be positive for Neospora. So I suppose by recycling those cows, you're keeping it in the herd, and usually those recycled cows are probably the first cows to calve then the following year, often in calf to Frisian, And look, the likelihood of getting a replacement animal from them probably is probably high. And also, I suppose, look, a lot of these herds have been in the program for a number of years, and if they are testing positive, I suppose they're more aware of the disease. Um, if they are testing animals and they do get positives, they're putting those control measures in place by not breeding replacements from those animals. And I suppose the other important thing to remember with the Neospora for control is that, as we've said, look, the foxes and the dogs do carry it. So they can become infected by eating infected afterbirths. So it's important to manage those as best you can. So look, if a cow does calve and you see the afterbirth lying around, maybe put it down the slatted tank. And also, look, you want to prevent as best you can foxes and dogs from passing their feces on the feed. So look, protect the feed as best you can. It's difficult to do, but look, just as best you can, I suppose. Um, so that's the Neospora. We'll move on now to the BVD. So look, I suppose we're all aware that the BVD eradication program kicked off in 2013. So this is a nice slide here showing on the left. This is from 2014 actually. So the level of BVD infection that was in the country that year versus 2024. And there has been, a great reduction. You can say what you like about the eradication program, but look, it has been very successful in reducing the level of disease. So just a couple of statistics. In 2013, 66 out of every 1,000 calves that were tested from breeding herds were positive for BVD. And in 2024, that has reduced to 2 in 1,000 calves out of breeding herds positive for BVD. So, look, a great success story, really. BVD, it really had a very negative effect in farms. Look, I suppose, we all saw it, and it's not just the PIs that were born. It's those healthy calves that would be in the pen, maybe with those PIs. They would get infected, their immune system would be suppressed, and then they succumb to other diseases, pneumonia, scours, etc. So look, we have come a long way. Um, so just the next slide then is just showing um, what we've seen from the bulk tank testing. So the number of herds that are testing positive. So again, look, we've just picked one test a year, so the first test of the year, and compared them right through from 2017 up to 2025. And look, I think this speaks for itself. The level of positive herds has reduced year on year to where we are at now in 2025. We have a very, very low level of positive herds. Look, a lot of that is due to vaccination. Um, and I suppose, look, that's great. Um, and it's great that so many herds are free of BVD. But I suppose on the flip side of that is that means that antibody levels have reduced a lot. Herds are naive. If the infection does come in, animals are quite vulnerable to infection. And I suppose that really just underlines the value of the surveillance that the bulk tank testing offers herds that are naive for BVD. You know, like it's great to be able to monitor that. We might just put up a poll, Maeve, as to how many herds are actually vaccinating for BVD. So Maeve is just going to put up a poll, and if you just select whether you're vaccinating or not vaccinating. I think the
This is a bit
results
of
are
an
in favour there.
experiment. So we're not too sure how it will work.
Now the results are coming in, I think. So yeah, so 80%, 79% not vaccinating. And I suppose we don't ask for this test what herds are vaccinating, what herds aren't vaccinating. So especially these, some of these positive herds will actually just be vaccinating herds. The vast majority of them, I would say, Dennis.
Yeah, it is interesting over the years. I suppose obviously the PIs have reduced massively, and people have actually stopped vaccinating as well. And the result of that is that herds are starting, antibody levels are dropping, and herds, like you said, Elaine, are starting to become naive.
Yeah.
And the bulk milk is becoming quite a useful monitoring tool now for those herds, that if anything does happen, that it should show up quickly there in the spring.
Yeah. So, Dennis, I think you were going to give a run through IBR and lepto and salmonella for us.
I am. And the lepto, is it lepto or IBR? Oh, IBR is next, is it? So yeah, I suppose to start off with, we do two tests for IBR, so the IGB and the IgE. So we call it the vaccinating and the non-vaccinating test, and I'll come back to them in the next page. But I suppose clinical signs, you'll mainly see clinical signs, or the active signs of a BV or of an IBR infection in herds, in naive herds, so herds that have never had it before, and suddenly become infected, and it spreads around the herd. You'll see the kind of coughing, the respiratory signs, the high temperatures, that kind of stuff. But I suppose Rena Sayers did a fairly large trial back a good few years back now in around the country. And at the time, she actually found no difference in clinical signs between herds that had no infection and that herds that had high levels of infection. And the actual biggest finding in that trial was the production losses. So what she came up with at the time was herds that were heavily infected compared to the clean herds. There was a 200, when they adjusted for everything, there was a 200 litre difference in milk production, which is fairly significant. And in today's money and the way I suppose cows and herds have improved, that's probably even higher. It could be 250 litres per cow. So in any man's or any woman's language, that's fairly significant. So if you can control IBR, you mightn't see the signs of it, or you mightn't see any major difference. If you can control it through vaccination, you're going to see a big production benefit in the herd. So the prevalence then in herds joining, so we always have new herds join the program every year. So we'd find that about one in three of those herds, on average, from year to year, would be actually, they get a surprise from their first test that they'd actually be positive for IBR, and they mightn't have known it. And we do ask here, so we really do ask who is vaccinating because of the two different tests. And at the moment, what people are telling us is that 3/4 of the herds are vaccinating. So on the right there is a little graph of 1,000, these are 1,000 herds we picked out that were continuously in the program, the same 1,000 herds a few years back. And I suppose during the meetings, when we're looking at the results and meeting farmers, the real consistent thing we see is that when there's a good vaccination program in place, the vaccine does two things. It stops the shedding, so infected animals shed the virus. It stops the shedding, and it protects the uninfected animals. So if you have a good, strong vaccination program in the cows, the heifers, and the calves, what you should end up with is clean animals joining the herd of cows, and the actual antibodies, the wild antibodies, should decrease from year to year. And that's what the data showed us there, the orange line, that the level of infection decreased year on year over the years. You might move on there, Maeve, please. The next slide. So these are I suppose the two data sets then. On the left is the vaccinating herd. So this is about 3/4 of the 3,000 herds. So there's about 2,200 herds maybe on the left, and about 800 on the right. And what we're looking for here in the vaccinating herds is levels that are over 0.7 are quite low. They're very low levels of antibodies. So in the vaccinating herds, by and large, we can see that over the years, the levels of the wild antibodies decrease. and the non-vaccinating herds. So the vaccinated test actually leaves out the wild antibodies, or leaves out the vaccine antibodies, sorry, and just tests for the wild antibodies. So it's a great way of monitoring the level of wild antibodies in vaccinated herds. And in the non-vaccinated herds on the right then, which is about 600 herds, so the levels are actually, let's just have a look. Yeah, so I suppose we roughly about half those herds would be testing positive. And in fairness, a lot of those herds are probably, or some of those herds are actually vaccinating, and we don't know about it. We're on the wrong slide here. Was it IBR we were looking at in the previous one?
Yeah.
Yeah, we're on the wrong slide. Where's the IBR slide? It's not there. That's okay. So yeah, that's our IBR. So that's what we would have seen over the years. So on to the next one, onto lepto. So yeah, we're on to lepto here. So lepto, obviously a bacterial infection. Again, about 3/4 of the herds, of the 3,000 herds, are vaccinating for lepto. So on the left, sorry, this is what I should have been talking about. On the left, you have the vaccinated herds. So this is about 2,200 herds. And the green, so I suppose the number we use, that if they're over 0.3, if the levels are over 0.3, we're happy enough that the vaccine is working well and they have a high level of immunity. So you can see the green there are the herds that are over 0.3, and that's what we'd expect. So most of the herds of the 75% that are vaccinating, in our eyes, are achieving good levels of antibodies from the vaccine. And then the non-vaccinating herds, which are about 600 herds, and I suppose you could say in 2025, there's about half of them truly testing negative for lepto, and the other half are showing some level of antibodies. And the ones that are testing over 0.3 there, in fairness, are probably, there's a vaccine probably involved somewhere along there. So look, I suppose the big message with lepto, it's around, the vaccines are around with a long time, and obviously they're there for a reason. I suppose every spring we see some few herds that actually succumb to lepto. So kind of cows going back in milk, maybe mastitis, high temperatures, the odd sick cow. So I suppose the big thing with it is the vaccines work very well. I suppose in our eyes, there's very little argument against vaccination, but you're really rolling the dice a little bit. If you are testing clear, and you're not vaccinating, you are rolling the dice a little bit, because we
There's
do
an
see.
interesting question actually, Dennis, after coming in about vaccination. So it's from Sean Carney. So we always vaccinate for lepto in springtime, but couldn't get the vaccine this year to date. What would you suggest to do now? And I think, look, this would be a common enough scenario this year, Dennis.
Yeah, and it's a real pain when the vaccines become unavailable, and I suppose you have your vaccination routine. So you would have vaccinated in the spring, and I suppose the hard answer, and the people that probably don't want to hear, is that if it's lapsed probably 7 or 8 months at this stage, that you're talking about starting off with the primary course again, of two shots to start off, and once a year after that. I suppose the only thing is that coming up to the dry period now, so you could probably leave it go till the dry period, do your 2 shots during the dry period, and it becomes a dry period vaccine from now on, rather than a spring vaccine. This would be my preference, probably, to try and put in most of these vaccines in the dry period. So when cows are dry, they're under no pressure. I suppose the farmer is under, the herd owner is under less pressure, and maybe it's just a time that maybe suits a bit better if cows are going through the crush during the dry period, to put in the vaccine at that stage and get them out at a busy time during the spring when people are busy and cows are under more pressure in early lactation.
Yeah, and I suppose, look, the other thing with these vaccines, Dennis, is it's probably important to order them in plenty of time, not to be going the day you need them.
Yeah, it is. But I suppose at the same time, in fairness to people, that the supply of them is fairly frustrating. And I suppose the fact that we're so seasonal in Ireland, that our requirement for vaccinations is very seasonal as well.
Yeah.
And it seems to catch us out a fair bit. which is a hard one to explain, but yeah,
Yeah.
that's the way it
I
is.
suppose it's just to give yourself the best chance to actually.
Yeah, absolutely, to try and get them in time. I suppose they're the
Great.
two vaccines at the bottom. I know one of them is actually gone off the market, one of the main vaccines. So I think that's the that are available at the moment. And I suppose the other thing about lepto is it is one of these zoonotic diseases. So yeah, it can affect fertility. You can get mastitis, but zoonotic diseases that can be picked up by humans, and you can get human disease, and it's often one of the big routes of transmission is in the urine. So I suppose in New Zealand they call it milker's disease. In fairness, in New Zealand, the strain that's circulating in the cattle population in New Zealand seems to be more contagious and it picked up easier by humans and more pathogenic. But nevertheless, the strain in Ireland is a zoonotic, and such as another big reason to vaccinate is to protect human health as well as the animal health. Okay, Maeve. So on to salmonella then, and I suppose the trend here is that about 2/3, so it has actually increased in the last few years. About 2/3 of herds have told us at this stage that they are vaccinating. So there's two strains of Salmonella typhimurium, which would be, I suppose, known for abortion and abortion storms. Salmonella Dublin would be known for mainly causing abortion and abortion storms. And typhimurium then would be maybe more sick cows and scours and sickness in the calf shed and scour in the calf shed and all the rest of it. So I suppose anyone that has had a run-in with salmonella in the past as regards an outbreak or abortions there, and it's kind of from now on that they can happen, especially as cows are being dried off and as cows are being housed, wouldn't wish it on anyone or wouldn't want it to happen on their farm again. So I suppose it's probably even that the levels are quite low, and the regional veterinary lab, the data, there was even that graph is from a few years back, that big reduction that they saw in the regional veterinary labs. But that is, I just checked the recent data from the National Disease Survey, and it was last year, it was about 3% again of submitted samples, aborted fetuses, those kind of samples, about 3% were down to salmonella. So it was quite low, and it had reduced a lot. Back around the 2010, 2011, 2012, and that seems to have continued. But nevertheless, I suppose to me it's an insurance policy, because it's so devastating if you do get an outbreak, the amount of cows, the amount of abortions you can have, and the amount of animals that you can lose, and the value of those animals if you've built them up over the years and have good genetics. I think it's worth investing in that vaccination policy. So I suppose again, the reduction over the years, I would probably put it down to three things. Number one is the increased vaccination. So the vaccine works very well, very immunogenic vaccine. So we'll look at the results now on the next page. Another big one is the reduction in liver fluke, and liver fluke and salmonella are very much linked. That often you'll see if there's a high liver fluke infection, the herd is much more likely to succumb to salmonella. A salmonella outbreak. It seems to directly affect the animal's immunity to salmonella if there's a high liver fluke burden. And then the BVD reduction, as Elaine went through earlier on, that I suppose BVD, the massive reduction in BVD levels has had other benefits to animal health. So BVD, one of the big things it does is knocks the immunity of the animal and makes them susceptible to lots of other infections. So there are the three big ones that have seen a reduction in the prevalence of salmonella-related problems. So we'll just go on to the next slide and look at the graph. So on the left is the herds that are not vaccinating, so about a third. On the right are the herds that are vaccinating. So if we look at the right first, what we're looking for in the results is if they're up over 150, we're quite satisfied that the vaccination program is going well. I suppose those oranges, they can be herds maybe that the vaccination has lapsed a little bit, or they can be herds that have started off vaccinating for the first time, and it generally takes maybe a year or two for the levels to get up over 150. And on the left then, are the herds that have told us they're not vaccinating, so about a third of herds. And I would say certainly the bottom 20% of those herds are herds that are probably vaccinating, maybe have stopped or haven't told us, because you'll never get readings that high from actually natural infection. And then there's a cohort of herds there that are kind of in between. Sometimes there's vaccination involved. So if you buy in vaccinated animals, it'll affect the test, and the herd might test positive or the tank might test positive. So they're the ones that you'd have question marks, those low reds there on the left. So back over to you, Elaine, for mycoplasma.
Yeah, so this is just showing the mycoplasma results from June 24 and June 25. Somewhere between, I suppose, 40 to 50% of herds actually test positive for mycoplasma. I suppose the reason we haven't shown more results, more historical results, is that the pattern is similar. So, like I said, about 40 to 50% of herds testing positive. So a lot of herds will test positive and they will never see signs of disease. I suppose mycoplasma is a little bacteria that can be present and not cause any issues. But if you have any sort of a stressor, then that's when mycoplasma can really, kick off and start to cause, clinical disease. So in cows, you're looking at things like lameness, septic arthritis, you're looking at pneumonia, and you're looking at kind of mastitis issues. So mastitis would be hard to cure, could affect more than one quarter, maybe even all four. And then mycoplasma can affect calves as well. So again, pneumonia, again, joint infections. And I suppose the classic one with the calves is the dropped ear. So that's the classic mycoplasma in calves. So that's the table on the left. On the right then is just an example of a lung wash, some further testing just to test for mycoplasma to see if it was in fact the mycoplasma that was causing issues on that particular farm. So that's it with the mycoplasma. We might move on to the digital dermatitis, Maeve. So the digital dermatitis is our new test. So the last webinar that we did, we focused specifically on digital dermatitis. We had Jer Cusick, a lameness expert, on to speak about it. So look, if you're interested in digital dermatitis, or if it's an issue for you, that's a good one to look back on. So we've only had one test so far with the digital dermatitis. And look, I suppose about 20 to 30% of herds are testing positive for digital dermatitis. And I suppose about 50% of herds are testing negative. So we'll be testing for digital dermatitis twice a year. So the antibody levels to digital dermatitis, once animals are exposed to it, the antibody levels remain high for about 6 months, after which they reduce down to low levels again. So it'll be a good monitoring tool. I suppose the thing with digital dermatitis is once it comes into your herd, it can be very hard to eliminate it, but it can be managed. And I suppose this test will be a good indication of how well your management practices are working for your digital dermatitis control. So this table then on the right, we went through it in the last webinar, but basically we did a trial last year before we introduced this test, and we just saw a very, very strong correlation between herds that tested positive and herds that actually showed signs of digital dermatitis or mortellaro. So as you can see, there was 21 herds that had a high prevalence in the test. 86% of those herd owners said that they did have a lameness issue on farm, and 90% of them said that they had had a diagnosis of digital dermatitis, versus the 20 herds that tested with a low prevalence. Only 10% of those herds reported a lameness issue, and only 15% said that they had had a diagnosis of digital dermatitis on the farm. So look, I suppose, like I say, a very strong correlation between testing positive and signs of disease. So that's the digital dermatitis. Now we do have some other questions that have come in while we were having our discussion. So the first one is, can you get the bulk milk screening from all co-ops? And the answer to that is yes. So look, if you want to join the herd health program, just ring the office in Munster and they'll get you set up um, if you want to do that. Um, so then
The
this
IBR question there, Elaine, I probably got I went slightly haywire there when I was doing the IBR. I was expecting a set of results and they weren't there in the next. But so we meant to put up a poll there as well for the IBR. And what's the poll there? Maybe we're going to ask who's vaccinating once a year and twice a year. So the question is, if there's a lot of IBR carriers in the herd, should I vaccinate every 6 months? And how would lepto cause mastitis? Yeah, also lepto, I suppose it's a bacteria, and if it's circulating, and it is settle out in the udder and cause mastitis. So it would be systemic rather than up through the teeth. So to be a cow that was sick and the lepto was circulating, and she developed. So the answer to the IBR carriers would be yes. So we didn't have the slide now, but we have, obviously I mentioned the two tests, the IgB and the IgE. So the vaccinated test and the other test. And if you start vaccinating, the vaccinated test is a great way of monitoring the actual level of wild antibodies in the herd. And I suppose if there's high levels of wild antibodies, certainly our recommendation would be to go on the live twice a year if there's high levels of wild antibodies. And as I said, generally, if you have a good, robust program, you're vaccinating twice a year and starting with the calves, which is very important. So starting with the calves when they're over 3 months of age. So we'll say if you're doing January, July, you'd bring in the calves in July. And I would say over 90% of the herds we'd see anyway, the levels of wild antibodies would start to drop after 2 or 3 years when there's clean vaccine protected heifers start joining the herd, and generally have 20% replacement rate every year. So the levels start to drop every year. So the answer would be yes. And the once a year vaccination, then I'd have no issue with that if the biosecurity is good, and once your levels drop below a certain level, or in the test, it's when they go up over 0.7. It means you have very low levels of wild antibodies in the herd. So you're into, I suppose, if they're high, you're kind of the vaccine, you're on a control job, live twice a year. If they're very low, you're on a prevention job. And I think the once a year does, depending on the circumstances, the once a year does the job when you're preventing rather than trying to control.
So the answer to the poll that's in, Dennis, so 64% of herds are being vaccinated once a year and 36% twice a year.
Which is interesting. About 2/3 are vaccinating once a year. So, and I think the bulk milk screening is a great way of putting a bit of science and putting a bit of data that if your levels are low enough that you're gone into prevention mode rather than control mode. And if you're in prevention mode, I have no issue with once a year. But if you're in control mode, I think it's hard to beat the live vaccine twice a year. And the bulk milk results will tell you that.
There's another question there now, Dennis. Would you give Ivermectin Super to in-calf heifers now?
Ivermectin Super, so there's ivermectin and there's closulon, if I'm pronouncing it right, is the fluke drug, which does mature fluke only. So as far as I know, suckler heifers, no problem, but not dairy heifers at this stage. The withdrawal, I couldn't say offhand now, but to my memory anyway, you're getting to the point now where you'd be in trouble with the withdrawal with the Ivermectin Super.
Yeah. So then another question, any reason why the antibody levels are dropping when on a live IBR vaccine for the last 10 years? So I'm not sure.
Say that again now, Elaine.
So the question that has come in says, any reason why the antibody levels are dropping when on live IBR vaccine for the last 10 years?
So I presume they mean the IBR or the levels are not dropping. rather than if they're
Yeah.
dropping.
If they're dropping, that's what you want to see, the
It
levels
is.
of wild
I
virus.
presume they're not dropping. And I suppose one of the most common, there's a few things. One is if, and I'm not saying this is the case now, but if you're not adhering, if it's not being given every 6 months, so there's something being missed maybe along the way. And probably the most common reason we'd see is that not starting early enough with the vaccine. So if calves pick up the wild virus early in life, they'll produce the wild antibodies and they will test positive for life, regardless of the vaccine. The vaccine could be working perfectly and controlling the infection, but once they have it, they'll test positive for life. And what we would often see in cases where the levels aren't dropping like you'd expect is that the young stock have picked up the infection. Maybe they're being reared in an out farm or whatever the circumstance, that they're picking up the infection in their first year, and then the vaccination program starts. And the vaccine does its job, it controls the infection, but they'll have the wild antibodies and they won't drop as they should.
There's another interesting question here, Dennis. There is a company offering a vaccination program that covers IBR, lepto, salmonella, and BVD. You put it in the water trough for 4 days for 4 months, then skip month 5 and do it again for 4 days on the 6th month. What do you think of doing this?
I presume it's kind of homeopathy we're talking about here.
I would assume, yeah.
So I suppose, like, I won't we won't go into opinions about different things. Look, there's I suppose there's lots of different beliefs out there, but to me, it's not like homeopathy is not a conventional vaccine anyway. And I would have seen people that would have been using, I suppose, those kind of protocols. And what's interesting to me is that they don't. We just say they were completely negative for lepto, and they were using that lepto product. There would be they would stay completely negative for lepto. So with a conventional vaccine, the levels of antibodies will go through the roof for salmonella, for IBR, for BVD, for any of them. It'll drive the levels much higher than any kind of natural infection. So they're very immunogenic. That's what gives the strong protection. But what I would have noticed over the years that that herds that were using those products that would be negative for a particular disease, there would be no change. So I would say they're not conventional vaccines. And after that, I don't know enough. I wouldn't know enough about or claim to know enough about it.
So then I suppose sticking with vaccines, how many times until what age would a herd owner use pneumonia vaccine on livestock?
So,
I'm not sure. I suppose maybe they mean IBR. I'm not sure.
so
How
up
many
to what age
times
would they?
until what
Pneumonia
age?
vaccine, they're probably talking about RSV, PI3, Pastorella, those kind of type vaccines. So certainly a great, I think a great idea in young stock, and if you're getting issues in the calf shed, I mean, there can be lots of contributing factors, but the intranasal vaccine or the injectables can be a big help. And I suppose the time of year we have at the moment, Elaine, a lot of weanlings are still out. There has been a nice bit of coughing this year, even it was kind of a mixed summer. I think there has been a nice bit of lungworm and a nice bit of coughing in calves. So one of the two big things you want to do really with calves, I think, or with weanlings, and all weanlings are very valuable now. So you want to house them and as best you can and avoid any problems after housing. So you want to try and house them with a clean set of lungs is a big thing. So if there is coughing, if there is lungworm, try and get that treated now in advance of housing. I would say there's probably still time in most places. And I would, if you haven't done any vaccine for RSV, PI3, you're probably running out of time for the 2-shot vaccines like Bovine or one of them. But certainly the 1 shot up the nose for RSV, PI3, even 2 weeks before housing is a massive help to try and prevent respiratory problems going into the shed. So I think it's a bit of a game changer if you're used to getting, if you've been getting virus pneumonia or problems, and the last thing you want to be doing now is treating animals with antibiotic powder or anything after going into the shed. Or the biggest thing is if they're getting sick, the lack of performance, the lack of thrive, and the worry and stress of it if you've weanlings sick after housing. So house them try and get rid of the lungworm before housing, and one of those RSV PI3 vaccines up the nose. They work quick, we get quick immunity, and they're a big help. And obviously the IBR as well. You'd hope that that was done already.
So this then ties in nicely with it. If calves are coughing in the shed after being dosed with ivermectin 1 month ago, what is wrong with them?
So if they're coughing in the shed, so if these calves are obviously, they're either gone in or they're still in. I'm not sure. I suppose they're gone in at this stage. These calves are probably gone in, surely, yeah, if they're worried about lungworm. So yeah, it could be. You'd hope that the ivermectin worked and sorted out the lungworm. So it could be one of those viruses, RSV, PI3, something like that. That's ongoing, or even IBR. So
yeah.
So look, if they're probably not sick by the sounds of it, but I definitely take a few temperatures, and I definitely maybe have a chat with the vet as regards the next course of action, whether it is diagnostics or maybe there's a vaccine that they might recommend, like the RSV PI3. Yeah.
So then I suppose there's just two final questions. One is about the vaccine for mycoplasma. Can it go into animals with other vaccines? So I suppose, Dennis, the mycoplasma, I suppose the first thing is the vaccine is actually only licensed for use in calves. It's not actually licensed for use in adult cattle. And I suppose it's not licensed for use with any other vaccine. So the recommendation is that, unless they're licensed for use together, you kind of leave 2 weeks between vaccinations to give the immune system a chance to.
Yeah, these vaccines are expensive, so you want to get the best
Exactly.
response you can out of them. But I suppose this is a new vaccine, so certainly this vaccine, I'd be slow enough. I'd be inclined to move it on its own. Yeah.
There's another question: where can someone send dung samples? Have a cow scouring bad? Thanks. So I suppose that's really your own vet, Dennis, isn't it? They can facilitate that, whatever lab they use, they'll send the samples there. Isn't that?
Yeah, that'd be the first point to call. Take your sample, and day of the week we know Wednesday. So if you take it, yeah, sure, look, you could take it now, but I suppose with a lot of these samples, you'd like to get them in early in the week, and you'll probably get a result by the end of the week.
And then we've just one more question after coming in: getting a good few cases of pneumonia in cows in spring, early summer. Would a vaccine help, or is it just stress, low immunity related? I suppose, we don't have a massive amount of information here, whether they're being,
Yeah,
vaccinated already for IBR or.
it would be interesting to see the IBR status. I suppose if they have, by all means, if you're on the program, give a buzz in, and we could have a chat through it. But to be interesting to know what the story with IBR is. But certainly the spring is a time where things can, I suppose, problems can surface because cows are under pressure. Early lactation, there's always a bit of negative energy balance going on. Weather can be bad, all the rest of it. So if there is stress, there's always stress. And I suppose the system might try and minimize that in the first place, get the nutrition as right as you can. But yeah, there could be the IBR would be the first protocol, but there could be other things going on as well. And yeah, sometimes there's other vaccines that can help.
So look, I think that's it, Dennis. I think that's a good place now to wrap it up. Thank you everyone for listening, and hopefully you found it useful and interesting, hopefully. So thanks to Dennis, of course, and thank you to Maeve in the background for, making sure everything ran smoothly, and for the polls. So yeah, we'll be recording this, and if anybody wants to look back on it, or if anybody's interested in joining the Herd Health program, it would be great. Just ring the office and we'll set you up. Anything else to add, Dennis?
No, thanks to everyone for attending. We're delighted actually. A great turnout again. So we're planning on another one in the near future, a dry off webinar. So I suppose stay tuned. We'll hopefully have a guest on for that one, and we'll certainly try and do that before the main drying off season kicks off.
Brilliant. Thanks, Dennis, and thanks everyone.
Thank you, Elaine. Good night, everyone. Take care.
Night.